Welcome to this bite-sized video introducing you to how we maximise implementation and impact at NIHR ArcWest. Our aim is to provide you with some tools to think about how your research can make a difference to health and care in your own context. I am Clare Thomas, Implementation Research Fellow at NIHR ArcWest.
And I'm Sabi Redwood, Deputy Director at ArcWest.
The National Institute for Health Research defines impact as the demonstrable contribution that research makes to society and the economy of benefit to individuals, organisations and nations. Having impact and making a difference is a goal for all researchers working in ARCs. So, if we want impact to be our outcome, how do we get there? In this short presentation, we will introduce some strategies, methods and activities which aim to increase the impact of your research. When it comes to impact, there are no guarantees or quick fixes. Increasing your chances of having impact requires time and resources, sometimes dead ends and changes of direction, and sometimes a bit of luck. We hope to provide some suggestions of things to think about, examples from our own work, and signpost you to further resources which can help you on your journey to impact.
The first step to impact is generating research that responds to the needs of your collaborators. This is what the applied research collaborations were designed to do. This involves collaborations with the people who are most likely to use and apply your research. They are your key stakeholders, who might be health, social care professionals and service providers, patients and the public, policymakers and commissioners. Working with your stakeholders will help you to identify relevant research questions which address areas of need and design research to answer these research questions in a robust and timely way. Researchers want to do comprehensive and rigorous research, but this takes time and the context might require answers quickly. Balancing these competing demands is important to ensure the outputs of your research are valid, trustworthy, and importantly useful to those who will use your research. It is important to consider implementability throughout the project. Stakeholders can help you understand the realities of the context in which your research is situated. This is important when thinking about how and where your findings might be implemented. By creating an audience in waiting, we mean engaging with stakeholders from the beginning of your research and involving them in its design. They will then be expecting the findings and be ready to use the bespoke new knowledge you have created. In 2004, Trish Greenhalgh and colleagues published an influential paper about the spread of innovation. They talked about these three routes. Letting it happen is about the traditional academic endeavour. Do the research, publish a paper, present at an academic conference, move on and hope someone picks it up and uses it. This rarely results in impact. In this presentation, we are encouraging you not to stop here. Helping it happen refers to dissemination as well as communications and knowledge mobilization. We could also add collaboration, co-design and co-production with professionals and service users to help change to happen. Making it happen is about researchers playing an active role in designing and evaluating implementation strategies.
We will try and explain this further with the help of some potatoes. In this analogy, our research results are like the potatoes in the central picture, raw and covered in mud. They are not very appetising and aren't easily digested. These raw potatoes need to be transformed and can be prepared in different ways to make mash, roast potatoes, jacket potatoes or chips. Similarly, when we help it happen, our aim is to transform the key messages from our research in different ways to make them appealing and useful for our different intended audiences. Helping it happen involves tailoring communications to our target audiences by considering what and how we communicate about our research. For example, by considering where the audience looks for information and whether they are more influenced by policy, news media or social media, and if written or visual presentation would be best. Co-producing communication materials with members of your target audience will also help increase their relevance and accessibility. And you might want to think about different and creative ways to share your research, such as using film, animation, theatre, poetry or music. The images on this slide highlight some examples from our own work. The first were postcards and posters co-designed with service users and a graphic designer to promote the use of low dead space ejecting equipment amongst people who inject drugs. And the second were films created with members of the public to illustrate ways in which physical activity can be incorporated into everyday life. Helping it happen also involves knowledge mobilization, which is about bringing different stakeholders together to share knowledge in order to bring about change. Its aim is to create opportunities for two-way knowledge-sharing conversations between researchers and stakeholders, within which the different types of knowledge that each brings to the table is valued. These conversations can help to build longer-term relationships and partnerships to support both research impact and future research. The images on this slide were taken at an event organised as part of our Overcoming Barriers Autism in the Somali Community project. The relationships built over time between researchers, people with lived experience, community groups and health professionals were key to the success of this project in raising awareness of the challenges faced by children with autism and their families in migrant communities.
Going back to our potato analogy, making it happen is about integrating our research findings, the potatoes, into implementation programs, the completed dishes here depicted. The research findings, so our once raw potatoes, are working with stakeholders, the other ingredients, towards a shared outcome, namely the completed dish. I will stop using this analogy now, I promise. This work may include additional activities to help local implementers to adapt the implementation process to fit local contexts, infrastructures, and practices. It may include helping implementers measure outcomes or develop training materials to embed changes in routine practice. Making it happen is essentially about using implementation science to support the scaling and rolling out of an intervention or new service to work beyond the context in which it was originally developed. Here are some strategies to make making it happen easier. For example, build considerations regarding implementation into your research when designing or evaluating the new intervention or service. Make sure that you include an investigation of contextual factors into your research. Often this takes the form of exploring enablers or barriers, but there are other factors for which theories like normalization process theory or the consolidated framework for implementation research may be useful. Quality improvement methodology has also been used to facilitate implementation of an intervention. An example from our work with the West of England Academic Health Science Network is the PRECEPT program, which prevents cerebral palsy in preterm babies. Making it happen is a people thing, so collaborating with partners and stakeholders is always essential. Here are some key questions to ask yourself at the beginning of your work. First, what do you want to be different as a result of your research? What are the impacts you are striving for? Second, who are the people who can make this happen, and how will you engage them? Do you know who your key stakeholders are, how you will reach them, how you will get to know them? Are you working with the people who will be implementing potential findings or people who might benefit? And third, How will you work with them to make sure that change happens? What can you do together to bring about change? Are you considering different ways to involve diverse groups? Can you work with experts in public involvement or co-production? You're more likely to achieve impact if you plan for it, and it will help you make it happen.